Wisconsin Eye's 2014 election coverage is brought to you by the Wisconsin Hospital Association. For over 90 years, a valued voice for Wisconsin hospitals, supporting high-quality, high-value care in communities like yours.
Wisconsin Eye is at the Milwaukee Public Library interviewing candidates for the 2014 elections. We're interviewing State Representative Tonya Johnson from Milwaukee. She is a Democrat seeking re-election in the 17th Assembly District. Welcome back to Wisconsin Eye.
Thank you for having me.
So you're seeking your second term?
Yes, I am.
What issues did you work the hardest on in the first session?
The first session, I would have to say the issues I worked the hardest on were human trafficking. Milwaukee has a human trafficking problem here and basically throughout the state, but we're seeing it grow. And one of the reasons that we're seeing human trafficking grow in the state of Wisconsin is because not enough resources have been dedicated to making sure that the young children and women who are being trafficked actually receive help. It's one of the, I would say, the second, third largest crimes that we're seeing in the United States. But in Milwaukee, especially as the war is turned up on drugs, human trafficking is another commodity these individuals can switch into, because unlike drugs, once the supply is sold, it's gone. The human body can be sold over and over and over. And unfortunately, this state has a lot of vulnerable children that are finding themselves victims of human trafficking.
What's the key to fighting it? Do we need tougher laws or better relationships with parents and children, or?
Well, not only do we need tougher laws, but we also need resources. We need places for these victims to go once they've been identified as human trafficking victims. Right now, currently, Lad Lake has a facility with 5 beds, and that's 5 beds to serve this entire state. Whereas in Milwaukee County, the Bureau has identified at least 2 to 3 calls per month that have been flagged as human trafficking calls. So we are significantly under-resourced in terms of having some place for these individuals to go.
Are you going to, if you're reelected, are you going to, do you have a specific law in mind that you're going to be drafting for the next session?
I do, and it was a law that was drafted and introduced in this last legislative session, and it passed the Assembly Committee, and it was on hold for the Senate Committee, and that is our caregiver law. In the state of Wisconsin, if a child is known to be found to be involved in commercial sex acts or human trafficking, if the perpetrator is not a parent or a guardian or a caregiver, the Department of Children and Family doesn't have to launch an investigation.
I see.
And so with that being said, it's easy to understand why this is such a rampant crime here in this state, because our own Department of Children and Families don't have to get involved unless it's a parent, guardian, or caretaker. And in most cases, that's not the case.
Do you think you can get it through the Senate, assuming you're back next year?
I think I can.
Okay.
I think I can.
One of the biggest items in the next state budget, of course, is public schools. What's any specific changes to help MPS you would be pushing in the next session, Representative?
We have to fix the funding flaw for Milwaukee public schools. Our public school districts have seen a vast amount of cuts across the board in servicing some of our children, and especially in the city of Milwaukee. Milwaukee public schools service the bulk of the children, the majority of the children, and a lot of these children come from low-income families. And with that being said, they have a whole variety of issues and problems that are more than just educational. A lot of these children are homeless, and they're looking for a place to stay. A lot of these children are on the verge of being evicted, or they're living in homes that don't have electricity. And so these are all issues that the school system has to tackle in part of trying to educate these children. So we need to make sure that the funding flaw is corrected. I think that's one of the biggest issues in between the public and voucher fights. Parents are always going to do what's best for their kids, as they should. But in some circumstances, we do have some schools out here who are not serving the kids in their best interest, and those schools continue to get funding too, and that's the issue.
You mentioned the choice and the voucher, to use your term, fights, because it certainly has been. What do you think should be done? What's the next step in this debate over vouchers and choice in the next budget, Representative?
I think the biggest fight is that on the Republican side, voucher is wanting to be expanded.
Yes.
On the Democratic side, we're pretty much for public schools, and we don't want to see voucher expanded. I think the part that's being missed is what's in the best interest of the child. In Milwaukee, we have a lot of great public schools, just like we have a lot of great voucher schools. We need to be focusing on how to funnel more children into both of those functioning, thriving systems. There are a lot of things that MPS needs to work on, and there are a lot of things that voucher schools need to work on. My daughter goes to Pius, and she goes there on choice. And just having her in the system, I know that there are a lot of things that even our better private schools need to work on. For example, in that school there are no free and reduced lunch programs, where the vast majority of children that are coming on choice are low-income children. So in one way we're saying, yes, we'll educate your children, but we're not going to feed them. There are no transportation subsidies to that school. And if you're a low-income mom, even though you want your child to get the best education, if you're down to your last $20 and you have to go to work and that child has to go to school, that child is going to miss some days in school. So we need to make sure that all of these systems are working to benefit our children. And sometimes in terms of Milwaukee Public Schools, a parent's biggest concern is safety. So even if you have two schools that are compatibly equal, if one is safer than the other, you're going to choose the safer school for your child. So I think there are a lot of things that need to be addressed from both systems.
Recently, Governor Walker, as you know, asked for both the Senate and the Assembly to withdraw Wisconsin from the Common Core debate, from those standards. Your position on that?
I think we're moving too hastily. There have been thousands of hours spent in these teachers learning these new standards. Hundreds of thousands of dollars spent on Common Core in general. The SAT was just moved to match the standards of the Common Core, and we're talking about pulling out. We need to make sure that our children here in Wisconsin can compete with children in other states, as well as other children globally. And that's the thing that's most important. We need to make sure that we give this system an opportunity to really see if it works, especially in a time where we're cutting budgets across the board for a lot of our public schools. To reinvest in other programs is going to take additional resources, and it's going to take additional money. And until we can assure that these schools won't have to absorb that additional cost, then we need to proceed with caution. We need to give this program an opportunity to work.
Transportation funding. The Taxpayers Alliance says that if we keep transportation funding at the 2013 levels for the next 10 years, we're going to be $2 billion short. How do you think any deficit should be made up, ma'am?
I think any deficit that's made in transportation, however we resolve that issue, we need to use caution. And we need to make sure that we consider all forms of transportation, especially in a city like Milwaukee, where in some areas 3 out of 4 people are on the bus. We need to make sure that we're not just investing in highways, a luxury that some people don't have, but we need to make sure that public transportation issues are addressed too.
If it came with if it meant getting an RTA, would you consider raising either the gas tax or the $75 annual fee to register cars?
Well, I think anytime we raise taxes, we need to proceed with caution, because for a lot of people, this is a severely difficult time for them. And we want to make sure that there are no other ways that we could generate income or that type of income to pay for those services. But if push came to shove and there was absolutely no other way to fund the deficit, then I'm not opposed to that. But we want to make sure that if that is an option, that's an option that we have no other choice.
A question on health care. As you know, 1 in 5 Wisconsin residents statewide get their health care from Medicaid, and that number might even be higher in your 17th Assembly District. The American Hospital Association says that Wisconsin has the second lowest reimbursement rate in the nation. Do you think those reimbursement rates should be increased in the next budget, Representative?
I do, because anytime we have obstacles that prevent our low-income families from seeking medical coverage or getting the medical coverage that they need, it's an issue. Before this job, I didn't have medical coverage, so I understand the difficulty in trying to find free clinics. And there are some clinics that have affordable services, but if you have a significant health situation, that free clinic may not be able to deal with that. So you have some people who just don't receive medical services at all. I saw my daycare parents try continuously to just find dental for their kids. And that's a huge issue when you are on Medicaid, because you have a lot of dentists that won't accept it because of the reimbursement rates. And even myself, for the short time that I did have private insurance, I would call and look for a new doctor. And the first thing that you do, I'll use United Healthcare, for example. Well, is it through your employer or is it through the state? And if you say your employer, well, we have openings. But if it's through the state, I'm sorry, we're not accepting new patients at this time. So that's an issue. We don't want to give our low-income families health insurance that they can't use. So yes, our rates are significantly low, and we do need to do something about that.
There's an emerging big issue in the city of Milwaukee regarding the Milwaukee Bucks and how any new arena should be paid for. Let me ask you this. Should any state aid, state tax dollars go for any new arena, Representative?
I think that's a discussion that we need to have with the community. And right now, that discussion hasn't been opened up to that capacity yet. I love the Bucks. I think that they generate income for this city. I know that there are a lot of businesses downtown that are dependent on the Bucks business. But there are also a lot of people in this city who can't afford to go to a Bucks game, who are depending on this city for services that technically we tell them financially we can't afford to provide. So I think that this is a discussion that needs to be open to the public, and the public needs to decide what they want regarding the Bucks. Now, I understand that if this new arena isn't built, that there will be jobs lost. And Milwaukee doesn't have the capacity to absorb additional jobs lost. It doesn't matter if that job is paying minimum wage or if it's paying $20 an hour. That job is important to that family who's depending on it to take care of their children and their household needs. So it's definitely a discussion that needs to be had in the public eye, and not one that should be reached just based on how elected officials feel, but we need to have the opinion of the community.
There was a bill introduced last session. It'll be reintroduced next session to legalize medical marijuana. And part of that debate now is the experience in Colorado and state of Washington, where they've legalized recreational use of marijuana. Your feelings on those issues?
Marijuana is a very sore subject for a lot of the individuals in my community. Because of the war on drugs, we have seen more African American males incarcerated because of marijuana than anything else. The first offense is, it's just basically a ticket. The second offense is a felony. And if you have an individual who is an avid drug user who may not cause anyone else any other harm, he's not a violent criminal, but he has an issue with drugs, labeling him as a convicted felon after the second time prevents him from getting a job. It prevents him from being able to take care of his family. And it prevents him from obtaining financial aid to reach higher education. So I'm not opposed to legalizing marijuana. I think we need to see how it affects other states that have legalized it. But in to a large degree, marijuana in this state, to lock someone up for marijuana usage at $34,000 a year is costing taxpayers tons of money. And that's money that we can use to reinvest in our educational system, to make sure that our children can obtain higher education, but most importantly, to make sure that they can graduate high school.
And on a related subject, first offense drunken driving, do you think that should be a crime, ma'am?
I don't think first offense drunk driving should be a crime. I do think that we should look at drunk driving in comparison to how we sentence for other crimes. Basically, when an individual is drunk behind the wheel, that car is a weapon. And yet multiple offenses of that are not considered crimes, whereas second usage or second usage being found for marijuana is a felony. The proportions of those crimes are totally imbalanced. I think that individuals who receive multiple citations for drunken driving, of course, after the first time they haven't learned their lesson, there needs to be stiffer penalties. But I don't think making first-time offenses a crime or a felony is the way to go for Wisconsin.
And then finally, you have a third-party candidate on November 4. Do you want
Yes,
to highlight
I do.
any differences with with your opponent?
Well, basically the difference between me and my opponent is that I understand being the state representative for the 17th district is a huge task. We not only have economic disparities in this city and the state, we have economic disparities within my district. The 17th district is full of a lot of middle-class families, wonderful neighborhoods, but there are areas in that district where that you can't park and go door to door because it's just not safe. And these areas are full of children. There are areas where if you are born as an African American male, your chances are higher of being incarcerated or being killed on the streets of Milwaukee than it is for you to go to graduate high school and go on to higher education. That's unacceptable. And basically, it's about more than just not liking Obamacare or caring about the children in the Sherman Park area. It's about making sure that Milwaukee provides its residents and its citizens a better quality of life, regardless of your economic status and regardless of your zip code. And that's what I'm fighting to change for the 17th district and the city of Milwaukee.
Thank you. State Representative Tonya Johnson of Milwaukee is a Democrat seeking re-election in the 17th Assembly District. Thanks for meeting with Wisconsin Eye.
Thank you.
And this programming note, Wisconsin Eye appreciates the support of the Wisconsin Hospital Association, which represents more than 139 hospitals and health systems, for making these candidate interviews possible. Thank you.
Thank you.